what sort of preventive care does the older horse need? I think it's really important, and you're all getting the annual physicals on your horse. As they get older, you might want to up that to twice a year because things are happening faster, changes in their body. When you do this physical, you should probably start doing some blood work. And the blood work can be just a simple CBC chemistry, serum chemistry, and you're looking at liver function and kidney function and make sure that they aren't anemic and look at their white blood cells. But maybe if they're showing you any signs at all, you should do some metabolism or some endocrine testing for the Cushing's disease we talked about. Because the sooner you catch something like that and begin to treat it, the better you'll be. Don't forget the vaccinations, because we said earlier, their immune systems, like everything else, are beginning to shut down. They need all the help they can get. There was one study that vaccinated young or mature horses, and then also vaccinated older horses, and then they challenged them with a disease, and I think it was rhino. And who do you think of the two groups of horses came down with disease? The older ones, because they did not have as good a vaccine response. So you'll want to make sure to work with your vet and say, you know what, I have an older horse, and what sort of vaccine, what changes to my vaccine program that I've been doing all his life should I have now that he's older? Same with parasite control. We talked about maybe one of the reasons that they're not as digestively efficient is a lifetime of parasites doing damage in their intestine. You have to keep providing parasite control as they're older, because now they're not as good at fighting off the worms. So you have to step in there and make sure that they're still protected. You can't forget about the hoof care just because they're retired. There was a slide earlier that said they're more prone to laminitis, hoof abscesses, arthritis. You want to make sure that foot, that leg, is able to break over as easily as possible. So you've got to get your farrier out there. Maybe they don't need shoes anymore, but they need trimmed regularly. It's very important. So as horses age, they're called hypsodont, meaning their teeth grow all the time, like rabbits. They have a lot in common with rabbits, actually. And their incisor angle, it starts off kind of, not vertical, but fairly up and down, you know, the top and the bottom. As they grow older, the angle of the incisors gets longer. So they're less able to grasp and cut off pasture, long stem forage, okay? So that's one problem as they age. Also, as their teeth are growing out, and here's your word for the evening, I write this one down. If you have a space between your teeth, because when the tooth starts growing, it's got a wide grinding surface, and as it grows up out of the horse's mouth, it gets smaller and smaller and smaller. So if they were touching when the horse was 5, and this is growing up and out, by the time they're 15, 20, they've grown apart. There's a space in the teeth, and it's called diastema. And 2 spaces are a diastemata. It's a pretty cool word, huh? You might need it for a crossword puzzle, I'm just saying. But so as their teeth are growing, there might be a loose tooth, and it's really, really excruciatingly painful to try and eat with a loose tooth. I had a horse that I rescued, because that's what I did 2, 3 jobs ago. And the people called me crying. They were going to put her down finally, Amber. She was 30. It was her time. And I said, could I come out and look at her? Well, we've had everyone look at her. We've done blood work. We've had her teeth done. There's nothing you can do. Well, okay, if you want to look at her, fine. She had a loose tooth in there, fell out in my hand. Instantly, she began eating. In 30 days, I didn't recognize her. She went from a 3 to a 6. And she was going to get put down. So I'm just saying, don't overlook how important the teeth are. If you lose a tooth, so now she had a new problem, because her teeth grow all the time, but one was missing. So there was nothing to keep the tooth from the top, from the bottom, from growing up in the hole. So then you'd get what's known as a step mouth. A less aggressive version of this is a wave mouth, and I have pictures to show you. Also, periodontal disease, abscess. How do you know your horse has dental disease? You're never going to see these things because you're going to have the dentist out twice a year, and you're never going to let the horse get this bad. But if you did, there's the quitting we talked about, slow eating, tilting the head while you're eating, slobbering, dropping the head while you're eating, not eating well, and then seeing some undigested feed in the manure.